My name is Jessica Okbehio, and sitting across from me is Dr. Patricia Benner, the author and of the Novice to Expert Nursing Theory. She's my all-time favorite nursing theorist. We are at Addison Bakery where we're having some delicious coffee and we're chatting over coffee and delicious pastries. Now, before we go into the questions I have for you today, Dr. Benner, let me just provide a brief summary of Dr. Benner's Novice to Expert Theory. Now, the novice to expert theory was adapted from the Dreyfus model of skill acquisition in 1982, and the theory is a model of clinical skill acquisition and describes the progression of nurses from beginners to experts through 5 stages of proficiency. Now, the theory also highlights that nursing expertise is gained through practical experience and not just theoretical knowledge. Now, there are 5 levels in the model of the novice to expert nursing theory. Now, the first stage is the novice level, where the nurse has little to no real life nursing experience, is heavily reliant on theory and abstract rules and regulations. And then one step up is the advanced beginner level, where the nurse has some real life experience and is now starting to be able to recognize recurring patterns. Now, the third stage is the competent stage, where nurses are able to consciously plan and organize individualized nursing care plans. Now, the fourth stage is the proficient stage, where nurses are now more intuitive, more flexible, and greater able to see situations as a whole. And finally, the expert nurse is highly skilled in has an intuitive grasp of situations, can make decisions with ease and with flexibility. Now, so that's the theory in a nutshell. The theory is widely accepted all throughout nursing and has been found useful in nursing management, academia, all across, and even in clinical practice. And I find it very useful because Dr. Benner's picture of the expert nurse, it paints a picture of the nurse that we should all aspire to be. But I have a few questions for you, Dr. Benner. My first question is that your theory paints a picture of a linear transition between stages. Um, but are the transition between the stages, is it always consistently linear? Now, I'm asking this question because Rikers et al. In 2002 found that individuals can be fluent in one subfield and less fluid in another subfield of the same domain, which I found to be true in my own practice. Now, I've been a bedside nurse on the same unit for almost 10 years, so I have a level of expertise. But perhaps due to my personality, I find that I excel in some areas of nursing practice, but in some other areas I am struggling. So, can you shed some light on this phenomenon? Now, my second question is that I've read your original article on the theory, which was published in 1982, and your subsequent works, where one of your main tips for nurses to move up the ladder is through mentorship by expert nurses. But a critique of your theory is intuition as a phenomenon is too subjective, and this was the major bone of contention that English had with your theory. The article by English was published in 1993. Now, I know intuition is real. I've experienced it in my practice where I had a gut feeling about something, and I could not articulate what set off the alarm bells, but I turned out to be right. But how do we role model intuitiveness if we ourselves cannot articulate it in objective and concrete terms? Now, my third question is that your theory paints an idealistic picture where nurses have the time to mentor newer or novice nurses. But that's not the reality of modern day nursing. We're overworked, we have impossible workloads, and even when I was a preceptor for nursing students and new nurses, we barely had time to get through the day. So, how do you think modern day nursing challenges how are they affecting the development of clinical nursing expertise? Now, finally, I've been a nurse with the organ transplant population for almost 10 years, but I'm hesitant to call myself an expert because the expert seems to know it all and is perfect in every way. But I don't know of any nurse who has the answers to every situation and with every patient. So, final question for you is Can we truly attain expertise in clinical nursing?